Health Organization Executive Board is extremely important since it binds us all together and enables us to set the directions and agenda and continue striving for our objective of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We all know that the hard work and determination of WHO member states have saved countless lives, improved public health, and increased life expectancy. The solidarity and cooperation that has defined our work for 7 decades has been central to the COVID-19 response. The values expressed in World Health Assembly resolution on COVID-19 response have continued to guide the work of WHO and its member states, and we will be apprised of the progress in the implementation during the course of this session. While COVID-19 has revealed the need to invest in health and the call for sustainable funding to WHO to ensure that the organization can fully respond to public health needs, any proposed increase in budget needs to also consider the global economic impact of COVID-19. We all know that the pandemic has affected the economies of countries globally. However, it has also presented us with an opportunity whereby health has been placed central on the global agenda of governments, partners, and donors. Excellencies, distinguished delegates, and partners, COVID-19 has provided a new lens through which to view how healthcare is delivered and what is possible to achieve. How can we seize this once-in-a-generation opportunity to realize our shortcomings and yet at the same time seize the opportunities? I have mentioned on earlier occasions also and would like to reiterate that as chairperson of the executive board, my focus is on equitable, affordable, and accessible healthcare for all, particularly to protect the health of those without wealth. You will agree with me that there is always a scope of improvement in what we have done. We improve ourselves by learning lessons from the past and by imagining the future. We need to see what worked best and what reforms we should make for a better tomorrow. We can find satisfaction in the fact that collectively we faced unprecedented challenges with resilience, even as we were grappling with uncertainties and the fact that essential healthcare services continued despite setbacks in the initial response period. However, we need to do much more going forward. While each country has its unique approach in dealing with public health based on the strengths of their existing health systems and national policies and programs, I am sure that together we will continue to bring about improvements aligned with our collective discussions. The response to this pandemic has been stressful and challenging, and we will continue to be asked to deliver our best in the ongoing response and beyond into the recovery phase. Excellencies, before I end, I would like to compliment the Director General and the regional directors for deciding to award the 2020 DG's Award for Excellence to all members of the WHO workforce. It is indeed a very thoughtful decision, and for the exceptional contributions made by all the WHO staff in supporting the pandemic response, a well-deserved achievement. My friends, the beginning of this year has been a very humbling experience. The last 20 days have been a victory for science and humanity. People have started getting vaccinated across many countries of the world, and that's overwhelming. Hopes are high, but there is still much to learn and many barriers to overcome. New cases of COVID-19 continue to be recorded. There is no room for complacency. Today, I call upon all of you to renew your commitment to help people and societies in special situations, especially the weakest and the most vulnerable, and recognize that many governments have offered their assistance and support to others in a spirit of solidarity and mutual support. Today, let us also pledge our commitment to the decade of action and delivery for sustainable development, and continue relentlessly to work to mobilize a coordinated global response to the pandemic. Today, all governments must rise to the challenge. Only then faster growth and higher living standards will be within their reach. The 2020s began with a cry of pain, but with the right policies, the decade could end with a roar. I once again thank all of you for reposing your faith and trust in me, and look forward to our discussions in this session. Many thanks for granting me the privilege of addressing all of you. Thank you. Colleagues, due to the current restrictions imposed in response to COVID-19, EB 148 will be held virtually. Before we proceed, I would like to say a few words about the virtual platform. Participants on the virtual platform may request the floor by raising their hands. This involves clicking on the icon labeled Participants at the bottom of the screen and then clicking on the button labeled Raise Hand. In terms of procedural motions, member states wishing to raise a point of order or exercise a right of reply should do so by sending a message to the following telephone number by SMS text or by WhatsApp: +41 79 467 2870. I repeat, +41 79 467 2870. The number is the same that member states used during other recent governing body meetings, and it may be used for points of order, requests, or rights of reply or other procedural motions only. It may not be used for any other matter. The telephone number can also be found in the practical guide for decision making and procedural issues on the virtual system contained in the document EB 148/info/5. Special procedures to regulate the conduct of this virtual meeting. We shall now take up the draft decision contained in document EB 148/2 concerning the special procedures to regulate the conduct of this virtual session of the Executive Board. May I take it that the Executive Board is ready to adopt the special procedures contained in document EB 148/2 and to apply them to this meeting. I see no objection. The decision is therefore adopted. The special procedures set out, among other things, how delegations may address the meeting. In addition, please note that as in a physical meeting within member states delegations, the matter of authorization to take the floor is a matter for the delegation itself. Accordingly, and in line with normal practice, if an alternate or an advisor who has been duly registered as part of the delegation presents themselves to speak or vote on behalf of a delegation, it will be assumed that they are authorized by the delegation to do so. In addition, I would like to make clear that I propose to accord the right of reply if sought at the end of each day. Delegates are kindly required to keep their interventions as brief as possible, and in the interest of time, it would be appreciated if the interventions could be limited to up to 3 minutes. May I take it that the board is content to proceed on this basis? I see no objections. Let us now turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this season's provisional agenda contained in document EB 148/1 and EB 148/1 annotated. In accordance with Rule 8 of the Rules of Procedure of the Executive Board, the officers of the board met with the Director General on 16th September 2020 to review the draft provisional agenda of the 148th session of the board that had been circulated to member states on 19th June 2020. Proposals received from member states by the deadline of 11th September 2020 were considered. Following the resumed 73rd meeting of the World Health Assembly, the officers of the board and the Director General met again on 27th November 2020 to review an updated version of the draft provisional agenda. You will find the details of the consultations and the recommendations on page 8 to 10 of the English version of the document EB 148/1 annotated. I now wish to draw your attention to item 17.5. This is amendments to the financial regulations and financial rules, if any. The Secretariat has informed me that there are no amendments to the financial regulations and financial rules. In view of this, I propose that this agenda item be deleted. May I take it that this proposal is acceptable? I see no objection. It is so decided. Are there any further comments on the provisional agenda? Thank you. The agenda is therefore adopted. I understand that the delegation of Austria has requested to take the floor. Austria, you have the floor.
Thank you very much, Mr. President, Director General, members of the Executive Board, dear colleagues. The European Union works closely with the World Health Organization on a wide range of subjects, both within the European region and on a global level. As agreed in the exchange of letters of 2000 between the WHO and the European Commission concerning the consolidation and intensification of cooperation, and without prejudice to any future conclusion of a general agreement between the WHO and the European Union, the European Union delegation attends the meetings of the Executive Board as observer. As in previous EB meetings, we ask the Executive Board to kindly agree that the European Union delegation is also invited to attend and participate without vote in the deliberations of the meetings of its committees and subcommittees, drafting groups or other subdivisions thereof, addressing matters falling within Union competence in the sessions of the Executive Board. Thank you very much, Mr. President.
Are there any objections to this proposal from Austria? I see no objections. As you know, EB 148 has a heavy agenda with 48 items and sub-items and more than 22 draft resolutions and decisions to be examined. It is important that we hold the meeting in a constructive manner. I would like to inform you that the individual statements by members of the board will be limited to 3 minutes. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invited representatives of the United Nations and other participating intergovernmental organizations and non-state actors in official relations with WHO will be limited to 1 minute. Regional and group statements will be limited to 4 minutes. When we move to the agenda items considered last week by the PBAC, I propose to build on the good work of that committee by focusing on discussion on the PBAC report and its recommendations, rather than having another full discussion of each of the documents. May I take it that these proposals are acceptable? I see no objections. It is so decided. Let us now review the preliminary daily timetable contained in document EB 148/DIV/2. After we complete our discussion of item 1, we will take up item 2. The report of the Director General, and the Director General will present his report. Then we will consider item 3, report of the regional committees to the Executive Board. Next, we will turn to pillar 2 and take up item 14, public health emergencies, preparedness and response. We will consider sub-item 14.1, COVID-19 response, and a technical update will be provided by the Secretariat. We will then consider sub-item 14.2, WHO's work in health emergencies and updates by the chairpersons of the various review processes will be provided. When we turn to pillar 4 and take up agenda item 4, report of the Program, Budget and Administration Committee of the Executive Board, an update on the prevention of sexual harassment and abuse will be provided following our consideration of the report. In terms of items that will be taken up together, the provisional daily timetable proposes the following. Under pillar 1, Item 10, substandard and falsified medical products, and item 11, standardization of medical devices nomenclature will be considered together. Under pillar 2, sub-items 15.1, poliomyelitis eradication, and 15.2, polio transition planning and post-polio certification will be considered together. Under pillar 4, I propose that sub-items 17.2, update on the financing and implementation of the program budget 2020-21, and 17.1, proposed program budget 2022-23 be taken together. Consideration of these sub-items will be followed by a separate discussion on sustainable financing. We will also take sub-items 17.3, scale of assessments 2022-23, and 17.4, status of collection of assessed contributions together. Similarly, under item 21, staffing matters, I propose that we take together the following sub-items. 21.1, statement by the representatives of the WHO staff associations. 21.2, report of the Ombudsman. 21.3, human resources update. 21.4, amendments to the staff regulations and staff rules. 21.5, report of the International Civil Service Commission. Do I take it that the board agrees with these proposals? I see no objection. It is so decided. I propose that the board meet from 10 a.m. to 13 a.m. p.m. and from 2 p.m. to 5 p.m. Geneva time. There will be a maximum of 2 sessions each day. It is also useful to recall decision EB 147-6, in which the executive board decided that this session of the board should close no later than Tuesday, 26th January 2021. Do I take it that the board agrees with the timetable? As I see no objection, it is so decided. When delivering statements, I would like to remind delegates to speak at a moderate speed that allows for its interpretation and ensures their message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int. This does not prevent you from making changes on delivery, but will facilitate clarity and accuracy in all languages. If you want your statement to be posted on the WHO website, or if you have a longer statement with information you would like to share additionally, you may send it to the email address statements@who.int. Please note that written statements will not be included in the summary record of the meeting. May I take it that these proposals are acceptable? I see no objection. It is so decided. This concludes our consideration of agenda item 1. Now let us turn to the next agenda item. We shall now let us consider item 2 of our agenda, report by the Director General. I have pleasure in giving the floor to the Director General. Dr. Tedros, you have the floor, please.
Thank you. Thank you, Your Excellency. Thank you for your leadership during these difficult times. Your Excellency, Dr. Harsh Vardhan, Chair of the Executive Board. And Excellencies, dear colleagues and friends, good morning, good afternoon, and good evening to you all, and a Happy New Year. 40 years ago, a new virus emerged and sparked a pandemic. Life-saving medicines were developed, but more than a decade passed before the world's poor got access to them. 12 years ago, a new virus emerged and sparked a pandemic. Life-saving vaccines were developed, but by the time the world's poor got access, the pandemic was over. 1 year ago, a new virus emerged and sparked a pandemic. Life-saving vaccines have been developed. What happens next is up to us. We have an opportunity to beat history, to write a different story, to avoid the mistakes of the HIV and H1N1 pandemics. The development and approval of safe and effective vaccines less than a year after the emergence of a new virus is a stunning scientific achievement and a much needed source of hope. Vaccines are the shot in the arm we all need, literally and figuratively. The recent emergence of rapidly spreading variants makes the rapid and equitable rollout of vaccines all the more important. But we now face the real danger that even as vaccines bring hope to some, they become another brick in the wall of inequality between the world's haves and have-nots. It's right that all governments want to prioritize vaccinating their own health workers and older people first. But it's not right that younger, healthier adults in rich countries are vaccinated before health workers and older people in poorer countries. There will be enough vaccine for everyone, but right now, we must work together as one global family to prioritize those most at risk of severe disease and death in all countries. For the past 9 months, the ACT Accelerator and the COVAX Vaccines Pillar have been laying the groundwork for the equitable distribution and deployment of vaccines. We have overcome scientific barriers, legal barriers, logistical barriers, and regulatory barriers. We have secured 2 billion doses from 5 producers with options on more than 1 billion more doses, and we aim to start deliveries in February. I use this opportunity to thank Gavi and CEPI. COVAX is ready to deliver what it was created for. But in recent weeks, I have heard from several member states who have questioned whether COVAX will get the vaccines it needs and whether high-income countries will keep the promises they have made. As the first vaccines begin to be deployed, the promise of equitable access is at serious risk. More than 39 million doses of vaccine have now been administered in at least 49 higher income countries. Just 25 doses have been given in one lowest income country. Not 25 million, not 25,000, just 25. I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries. Even as they speak the language of equitable access, some countries and companies continue to prioritize bilateral deals, going around COVAX, driving up prices, and attempting to jump to the front of the queue. This is wrong. 44 bilateral deals were signed last year, and at least 12 have already been signed this year. The situation is compounded by the fact that most manufacturers have prioritized regulatory approval in rich countries where the profits are highest, rather than submitting full dossiers to WHO. This could delay COVAX deliveries and create exactly the scenario COVAX was designed to avoid, with hoarding, a chaotic market, an uncoordinated response, and continued social and economic disruption. Not only does this me-first approach leave the world's poorest and most vulnerable people at risk, it's also self-defeating. Ultimately, these actions will only prolong the pandemic, prolong our pain, the restrictions needed to contain it, and human and economic suffering. Vaccine equity is not just a moral imperative. It is a strategic and economic imperative, and we know it. A recent study estimated that the economic benefits of equitable vaccine allocation for 10 high-income countries would be at least $153 billion in 2021, rising to $466 billion by 2025. That's more than 12 times the total cost of the ACT Accelerator. It's not too late. I call on all countries to work together in solidarity to ensure that within the first 100 days of this year, vaccination of health workers and older people is underway in all countries. It's in the best interest of each and every nation on earth. Together, we must change the rules of the game in 3 ways. First, we call on countries with bilateral contracts and control of supply to be transparent on these contracts with COVAX, including on volumes, pricing, and delivery dates. We call on these countries to give much greater priority to COVAX's place in the queue and to share their own doses with COVAX, especially once they have vaccinated their own health workers and older populations, so that other countries can do the same. Second, we call on vaccine producers to provide WHO with full data for regulatory review in real time to accelerate approvals. We also call on producers to allow countries with bilateral contracts to share doses with COVAX and to prioritize supplying COVAX rather than new bilateral deals. And third, we call on all countries introducing vaccines to only use vaccines that meet rigorous international standards for safety, efficacy, and quality, and to accelerate readiness for deployment. The theme for World Health Day this year is health inequality. My challenge to all member states is to ensure that by the time World Health Day arrives on the 7th of April, COVID-19 vaccines are being administered in every country as a symbol of hope for overcoming both the pandemic and the inequalities that lie at the root of so many global health challenges. I hope this will be realized. Excellencies, dear colleagues and friends, the pandemic has lessons for all of us, for every member state, and for the Secretariat. All of us must have the humility to learn, to change, to innovate, and to grow. The work of the Independent Panel for Pandemic Preparedness and Response, the Review Committee of the International Health Regulations, and the Independent Oversight Advisory Committee of the WHO Health Emergencies Program will all have recommendations for member states and the Secretariat. But several lessons are already staring us in the face. First, preparedness and response. COVID-19 surprised even some of the world's richest and most powerful nations. It caught them unprepared and revealed a collective failure to invest in emergency preparedness. Even before the pandemic, WHO was working to strengthen preparedness and response as part of our transformation, knowing that the next pandemic was just a matter of when, not if. With the World Bank, we established the Global Preparedness Monitoring Board 2 years ago. We created a new division of emergency preparedness, a new science division, and we developed new digital tools for surveillance and early warning. In the past year, we have taken further steps which are described in our report to you for this meeting. At the World Health Assembly in November, I announced the creation of a new repository for specimens at a secure facility in Switzerland to facilitate the voluntary sharing of viruses and the rapid development of medical countermeasures. We're calling it the BioHub. I'm pleased to say that in addition to previous commitments from Italy and Thailand, South Africa has now committed to share samples of the new SARS-CoV-2 variant with the BioHub. We encourage all member states to share data and samples of the new variants in a timely way. In November, I also proposed a new mechanism for strengthening preparedness based on mutual trust and mutual accountability, the Universal Health Preparedness Review. And I thank Benin and the Central African Republic for proposing the idea on behalf of the Africa Group. Previous tools such as joint external evaluations based on expert review of national preparedness have value, but the pandemic has shown they have not been sufficient. The Universal Health and Preparedness Review is based on a voluntary mechanism of peer-to-peer review led by member states to promote greater, more effective international cooperation by bringing nations and stakeholders together in a spirit of solidarity. In December, we briefed member states on the stakeholders together in a spirit of solidarity. In December, we briefed member states on the UHPR. We have begun discussions to develop the tool, and in the coming weeks, we plan to begin a pilot phase with the first group of countries that have volunteered. We encourage all countries to engage actively and to help us build this initiative together. The second key lesson the pandemic is teaching us is that the health of humans, animals, and the planet are intimately intertwined. We can only protect and promote human health by fundamentally enhancing the monitoring and management of the risks at the interface between humans, animals, and ecosystems. This is not a new idea, but the pandemic has brought it into sharper focus. More than 70% of emerging diseases discovered in recent years are linked to animal to human transmission. More than a decade ago, WHO, the Food and Agriculture Organization of the United Nations, and the World Organization for Animal Health came together at the tripartite to develop and promote the One Health concept. The pandemic has shown that we must take our partnership to a new level, and that it must become more than a concept. It must be translated into systems that keep people safer in countries. It's also clear that One Health must be about more than zoonosis. It must address the full range of issues that affect the relationship between humans, animals, and planet, including deforestation, intensive agriculture, pollution, climate change, and so on. Together with our partners in the tripartite and the UN environment, we have now agreed to establish a One Health high-level expert council supported by a joint secretariat. The council will analyze scientific evidence and policy responses in countries and advise the 4 agencies on actions to take and recommendations to develop.
A very good afternoon.
Priorities for the prevention, prediction, detection, monitoring, and response to emerging zoonosis with epidemic and pandemic potential. We expect the first meeting of the Council by the World Health Assembly in May, and we will keep you updated as the Council and its agenda takes shape. At the same time, we must translate this high-level work into concrete systems at the most local level possible to pick up signals of new outbreaks and contain them at source where possible. At last year's assembly, member states also requested the Secretariat to work with our partners to identify the zoonotic source of the virus. As you know, 14 members of the international mission studying the origin of the virus have now arrived in China. Another 3 are working with the team remotely. No one should be in any doubt that this is a scientific exercise. The objective is to understand how and when this new coronavirus emerged, so that we can all take steps to prevent the emergence of other zoonotic pathogens in future. The third major lesson the pandemic is teaching us is that the world needs a strong WHO. Again, this is not a new realization. Those of us who have been working in global health for any length of time know the strengths and weaknesses of WHO. Strengthening WHO is the focus of the transformation journey that we have been on together for the past 3.5 years. I provided an update on transformation in my remarks at the Assembly in November. I also refer you to the detailed progress report we published in December, and we look forward to your further feedback this week on the paper on transforming for enhanced country impact. We appreciate the broad support for transformation expressed by member states to date. And we welcome the comments made by the chair of the Independent Expert Oversight Advisory Committee during PBAC last week that transformation is delivering results. But we have also heard your call for more focus on transformational impact in countries. Transformation is a journey. We have already come a long way, and we still have further to travel. In the coming year, we will continue to learn, to change, and to listen. As you know, at the end of last year, the regional directors and I decided to award the WHO Award of Excellence to the entire WHO workforce for their extraordinary efforts in the most extraordinary year, as our board chair, Dr. Harsh Vardhan, indicated in his speech. And in recognition of 2021, at the International Year of Health and Care Workers, we have also decided to make 2021 the year of the workforce, to focus on making WHO an organization that attracts the best people, gives them the best environment, inclusive, diverse, and enables and empowers them to do and be their best. Member states have themselves identified that one of the biggest barriers to WHO being the best it can be is sustainable and predictable financing. We know member states are serious about strengthening WHO, so they must be serious about sustaining sustainable financing and about addressing the gulf between what is expected of us and the sources we have to do it. I would like to thank France and Germany for taking the lead on this issue. As you know, the Secretariat has made significant efforts to address this issue through the first WHO investment case, a new resource mobilization strategy, the first Partners Forum, and most recently through the formation of the WHO Foundation as part of the transformation which we started in 2017. The WHO Foundation is an independent legal entity that aims to generate $1 billion in the next 3 years from sources that WHO has not accessed before. Between 70% and 80% of those funds will be for WHO, and the remainder will be for other public health organizations focused on civil societies. The foundation has a strong board led by Dr. Thomas Zeltner, with representation from all regions, and its first chief executive officer, Anil Soni, began his work at the beginning of this year. We anticipate that the foundation will help to diversify WHO's donor base and will be a source of further flexible funding. Some of the strategic solutions that we proposed during the diagnosis when we started the transformation. However, there is still much work to be done to ensure WHO has sustainable and predictable funding it needs. This week, you will consider a proposal to establish an inclusive working group to define the principles for what should be funded, develop options for how much funding is needed, and consider how those priorities should be funded. If agreed by member states, the working group could consider a proposal that will come back to this board before going forward to the World Health Assembly in 2022. We're committed to accountability and to giving you value for money. And it's the right thing to do. But we ask our member states to ensure the Secretariat receives adequate money for value. Even as we work relentlessly towards ending the pandemic and responding to other emergencies, we will continue to transform to deliver an impact where it matters most, in countries. Your agenda this week reflects the immense scope of WHO's work, including patient safety, non-communicable diseases, oral health, eye care, antimicrobial resistance, orphan diseases, substandard and falsified medical products, mental health, polio, immunization, and much, much more. I know that some member states have concerns about the late publication of documents for this meeting. I personally apologize for any difficulty this has caused in your preparations. We remain committed to timely delivery of governing bodies' documents, and we have made very good progress in this area. We seek your understanding given the exceptional circumstances under which our staff have been working, and the very tight turnaround between the resumed World Health Assembly in November and this session of the Executive Board. We look forward to a constructive discussion this week as we work together to address the myriad other health challenges the world's people face every single day. By the end of this year, we expect to deliver up to 90% of the work we committed to at the beginning of the biennium. To respond to the disruption to essential health services in many member states, WHO is implementing a boost initiative to assign staff virtually from headquarters to work with regional and country offices in line with country needs. Full alignment of the 3 levels of WHO. In the first phase, staff have been assigned to 20 countries for system and community strengthening, financing, diagnostics, therapeutics, surveillance, and more. We will continue to support countries to progress toward this universal health coverage through intensified technical assistance for primary health care and to maintain essential health services, including for immunization and sexual, reproductive, maternal, newborn, child, and adolescent health. We will support member states to protect and expand fragile gains against HIV, TB, malaria, hepatitis, sexually transmitted infections, and neglected tropical diseases. We will implement the global strategy to accelerate the elimination of cervical cancer approved by member states in November. We will intensify our support for countries to progressively cover 1 billion additional people living with NCDs and mental health conditions by 2023 with essential health services and medicines. Despite setbacks last year, we remain totally committed to the twin priorities of polio eradication and polio transition, and to using polio infrastructure for the rollout of COVID-19 vaccines. At the request of member states, we're developing new strategic policy directions for nursing and midwifery. In light of the significant toll that COVID-19 has taken on older people, and to increase the quality of care they receive, we're studying the organization and financing of long-term care systems. We will continue strengthening country capacity to implement national action plans for antimicrobial resistance while strengthening surveillance of AMR and antimicrobial consumption. In response to increasing requests from member states, we will work to strengthen local production of and access to quality, safe, effective, and affordable medicines and other health products. Following approval of the Global Strategy on Digital Health, we are developing tools to support member states to implement national digital health strategies, including a digital vaccination certificate. We will work with countries to implement the policy prescriptions recommended in the Manifesto for a Healthy and Green Recovery. In June, we will host a virtual health summit for small island developing states, focusing on resilient health systems that can respond to the twin threats of non-communicable diseases and climate change. We will support national health data system strengthening through the SCORE technical package. We will continue to hold ourselves accountable through delivery stocktakes to track progress towards the 3 billion targets. We will strengthen the development of normative guidance to ensure it's timely, relevant, based on the latest evidence, and easy to access. We will strengthen capacity for high-quality ethical research in all countries and ensure accelerated scaling of innovations and health products to meet public health needs. And we will continue to strengthen collaboration with our multilateral partners through the Global Action Plan on Health and Well-being for All to reinforce vaccine equity, drive recovery, and support member states to get back on track for the Sustainable Development Goals. At the same time, we're also looking ahead to the next biennium, which is supported by the draft program budget for 2022 and 2023 that you will be considering this week. The draft budget reflects the need to forge ahead with the work we have to do, implementing the lessons we have already learned from the pandemic, even while we wait for the recommendations of various review processes. We have therefore developed a flexible program budget built around 4 key strategic themes. First, the urgent need to accelerate progress towards the 3 billion targets and the Sustainable Development Goals, including appropriate resourcing of country offices. Second, the need to strengthen health emergency preparedness and response at all levels. Third, the need to build resilience through stronger primary health care as a foundation of both health security and universal health coverage. And fourth, the need to advance WHO's leadership in science and data. The budget document explains each of these themes in more detail. It also proposes extending the deadline for the 3 billion targets by 2 years to 2025. Extending the deadline will allow us to identify the specific areas in which countries are lagging behind and potential solutions to accelerate progress. Excellencies, dear colleagues and friends, 1 year into the greatest crisis of our time, there is no question that we still face unprecedented danger. But we also have an unprecedented opportunity to make health the heartbeat of development and the foundation of a more secure and more equitable world. In the past year, we have lost more than 2 million of our sisters and brothers to this pandemic, including many health workers who gave their lives in the service of others. We have also lost colleagues, including Belinda Kasongo, murdered in DRC as she worked to protect others from Ebola. Her sacrifice was not in vain. It was because people like Belinda put themselves in danger that we were able to end the Ebola outbreak in eastern DRC, one of the most complicated emergencies we have faced. And next week marks 1 year since the passing of our dear friend and colleague, Pete Salama. Gone but never forgotten. His legacy lives on. We owe it to all of them to ensure that whatever challenges we face, we overcome them. Whatever lessons the pandemic is teaching us, we learn them. And whatever opportunities we have to build a healthier, safer, fairer world, we take them. I thank you.
Thank you, Doctor.
Thank you, Dr. Tedros. The floor is now open for discussion. I would like to request that the Secretariat moderate the discussion on the virtual platform. Secretariat, you have the floor now.
Thank you, Your Excellency, Mr. Chair. May we kindly remind those wishing to make an intervention to please raise their hand in the Zoom platform. I should now like to call upon the distinguished delegate of Burkina Faso to be followed by Austria and Finland. Thank you. Burkina Faso, you have the floor.
Thank you very much. Chairman, Burkina Faso has the honor to make this statement under Agenda Item 2 on behalf of the 47 member states of the WHO's African region. The African region would like to thank the Director General for his detailed report on the action taken by the organization in the context of the COVID-19 pandemic, and we'd like to congratulate him for his leadership in managing world health. We also pay tribute to the Secretariat, which has worked so very, very hard to support member states, despite the very difficult circumstances in which it's working at the moment as a result of the pandemic. We support the ongoing process of transformation within the organization. We also welcome the efforts of the Independent Group on Preparation for and Response to Pandemics in evaluating the work that the organization has done to tackle COVID-19. We urge WHO to conclude its work on looking at the origins of COVID-19 as quickly as possible and urge it to do whatever is required to prevent the emergence of other pandemics in the future and help states to prepare for them. We urge everybody involved in world public health to work together with the organization and provide it with sufficient funds for it to do its job. Chairman, turning to the issue of the distribution of a COVID-19 vaccine, the African region is rather concerned that the vaccine is being hoovered up by just a few countries, and we'd like to stress the need for the vaccine against COVID-19 to be considered as a global public good. As the Director General has quite rightly said, nobody will be safe until everybody is safe. That's why we encourage member states to give priority to international solidarity and take the steps which are required to make the entire world safe from the pandemic. The member states of the African region would like to underscore the urgent need for equitable vaccine distribution to all countries, whatever their level of development. African countries did quickly put measures in place in order to control the spread of COVID-19 and thereby limit its negative impact on their peoples and on their economies. Furthermore, the African region would like to emphasize that the COVID-19 situation should not make us lose sight of the priority that should be attached to controlling other endemic diseases such as malaria, tuberculosis, HIV/AIDS, neglected tropical diseases, non-communicable diseases, and cancers worldwide, especially in those countries most hard hit by them. Chairman, because of the negative impact of the COVID-19 pandemic, further efforts are going to have to be made by countries in order to provide WHO with the resources she needs to ensure that the program budget for 2022-2023 can fully implement the 13th General Program of Work. We encourage the organization to continue to look for sustainable and innovative sources of financing which will help it to be stronger and more effective in carrying out its mission. Thank you.
Thank you very much. And now to Austria, to be followed by Finland.
Mr. President, I have the honor of speaking on behalf of the EU and its member states, and the candidate countries, the Republic of North Macedonia, Montenegro and Albania, as well as the Ukraine and the Republic of Moldova align themselves with this statement. The EU and its member states welcome the global coordination, commitment and leadership of WHO, especially in response to the COVID-19 pandemic. Its action has been a safeguard for the most vulnerable populations, addressing gender and health inequalities, ensuring access to essential health services, and decreasing pandemic-related morbidity and mortality. We encourage WHO to continue applying a transparent, accountable approach to its action. We thank the DG for his report and remain fully committed to continue collaborating with WHO and regional office supporting WHO in its role as the leading global health agency now and beyond the current pandemic. A year into the pandemic, we have learned that collaboration, resolve and commitment on a global scale delivers results. We praise all singular and collective actors that contributed to the unprecedentedly fast discovery of effective vaccines, as well as the work to provide equitable access to vaccines and other necessary commodities. It remains crucial that no one is left behind, especially in fragile, low-resource settings and among populations who might be left out from regular vaccination campaigns. We need to make the same progress in treatments and clinical trials. The EU and its member states, as Team Europe, have stepped up by contributing to the ACT accelerator and joined the COVAX facility to promote equitable and affordable access to COVID-19 tools and immunization against COVID-19 as a good global public good. Mr. President, an effective, transparent and science-based investigation on the origin of the SARS-CoV-2 is paramount and can provide us with clues to respond to this and prevent future pandemics. Understanding that this endeavor may not be concluded immediately, we look forward to regular in-depth updates on the progress of the investigation. We reiterate our support for the work of the independent panel, IHR Review Committee and IOAC. We look forward to their recommendations to be considered in an inclusive progress involving all member states in developing a resolution on strengthening WHO and global preparedness facilitated by the EU. The pandemic has made clear once again that urgent needs to invest in and create resilient health systems. With the goal of universal health coverage and other health SDGs, we express concern about the growing gaps, inequities, and worsened health outcomes during the past year, particularly in sexual and reproductive health and NCDs, including cardiovascular diseases, cancers, diabetes, and mental health conditions. To contribute to enhance global health security, the EU has taken action towards building a European health union. We will improve EU's health security framework, reinforce crisis preparedness, strengthen the ECDC and EMA and consider the establishment of an EU Health Emergency Preparedness and Response Authority. We will work together in close collaboration with WHO and regional office. Today, we're all facing the same challenge. The EU and its member states will continue to be a driving force for multilateralism in addressing them and learn our lesson to be better prepared. Thank you very much, Mr. President.
Thank you, Austria. And Finland, you have the floor.
The General, colleagues, Finland aligns herself with a statement by the EU and its member states. We thank the Director General for his comprehensive report. The past 12 months have been the greatest challenge of our generation. The lives lost, the human suffering, and the economic losses cannot be retrieved, but we can do better going forward. Finland strongly believes that health and the economy are interlinked, and it is possible to protect both. We welcome the appointment of the Council on the Economics of Health for All, of which Prime Minister Sanna Marin will act as the patron, and look forward to its work, analyses, and recommendations. We also welcome the Pan-European Commission on Health and Sustainable Development, to which President Tarja Halonen brings her expertise. Scientific, strategic, political, and moral leadership have never been so critical in guiding the local community and individual countries through this crisis. While the pandemic is by no means over and significant efforts are required to control it, we have already started to look to the future to see how we might become better prepared and more adept in our response. Considering the lessons learned is a must. At the same time, we should not fall into the trap of predicting the future based on the latest experience. We can never know what the next crisis may be. We must be prepared for anything. The good news is that by taking an all-hazards approach and working together across different sectors and at all levels, including through multilateralism, we can take precautions for any eventualities. To strike the right balance between health and the economy in a sustainable manner, we must start investing more in preparedness at country level and globally. By building back better and by supporting people's health and well-being, we can mitigate the long-term impact of the pandemic and help restore progress on the Sustainable Development Goals. Thank you.
Thank you, Finland. And now to Kenya, to be followed by the United Kingdom. Thank you.
Well, he's not allowing. Thank you, Chairperson. Kenya aligns with a statement delivered by Burkina Faso on behalf of the African member states. Kenya thanks the Director General for his report and takes this opportunity to commend the DG and the entire WHO Secretariat for their commitment in coordinating the global public health response to the COVID-19 pandemic. Like most countries, Kenya is coordinating a national response to the COVID-19 outbreak, and we are grateful that the actions of our population in following the recommended public health measures have borne fruit, with Kenya now recording fewer number of cases and deaths for the past few weeks. Chairperson, Kenya welcomes the recent emergency use authorization by WHO on some COVID-19 vaccines and takes note of the disproportionate rollout of COVID-19 vaccines across the world. Given the catastrophic impact that the virus has had on our lives and livelihoods so far, coupled with emerging threats of new variant strains, Kenya calls for WHO, member states, and all international actors to work together to guarantee fair and equitable access to available COVID-19 vaccines. We regret to note that history is repeating itself yet again and calls for global solidarity, going silent over vaccine delivery, and distribution to low and middle income countries. As a member of the COVAX Facility Advanced Market Commitment, Kenya continues to support calls for vaccine manufacturers to swiftly facilitate the transfer of the required technology and know-how to other manufacturers so as to end the acute phase of the pandemic. Through the relevant UN organs, we also support initiatives aimed at easing intellectual property rights, which pose barriers to access to affordable medicines and vaccines for vulnerable people around the world. In conclusion, Chairperson, Kenya welcomes the preparation of the WHO program budget and takes note of the proposed 4 key strategic themes. We request the Secretariat to maintain the GPW13 focus on equity and progress towards universal health coverage as we accommodate the emerging priorities brought on by the COVID-19 pandemic. We stand ready to support the process and request the Director General to ensure that the needs of the most vulnerable are factored into the next budget. I thank you.
Thank you very much, Kenya. And now to the United Kingdom, to be followed by Romania.
Thank you, Chair. Thank you to WHO for your continued hard work in coordinating the world's health response to COVID-19. No one is safe until everyone is safe, and the health of every country depends on the whole world having access to safe and effective vaccines, therapeutics, and diagnostics. The UK is committed to rapid, equitable access the UK is committed to rapid, equitable access to safe and effective vaccines, treatments, and tests through multilateral collaboration. We are pleased, as well as being a top donor to WHO, to have helped raise $1 billion for the coronavirus COVAX AMC through match funding other donors, which combined with the 548 million of UK aid pledged will help distribute 1 billion doses of coronavirus vaccines to 92 developing countries this year. However, with new variants emerging around the world, it is essential that the international community is on the front foot and quickly enhances genome surveillance and reporting. We look to the WHO for leadership on this, and the UK stands ready to support. COVID-19 has highlighted the inequalities within and between nations and is reinforcing and exacerbating them, further risking the delivery of the Sustainable Development Goals. Continued collaborative effort will be required to tackle these inequalities, strengthening health systems and halting the backward slides in progress made against global health outcomes in recent years. It is important that the 148th Executive Board has met not just to discuss and make decisions on issues directly related to COVID-19, but also on a range of other important health topics, including AMR, patient safety, HIV, NCDs, and disability. Yesterday, our Prime Minister officially launched the UK G7 presidency. We are pleased that this will include a health track. This will continue a focus on the response to the challenges of the ongoing health crisis, whilst looking ahead to how we can do better for the future. And the UK will continue to look at how we can globally build back better as we host COP26 in the autumn. Climate change continues to be an important global health issue. The public health motives for action are based on strong and compelling science, and health systems are key to mitigating the health impacts of climate change, whilst they themselves are vulnerable to its impacts. It has been a challenging 12 months for us all, but I'd like to finish by expressing our profound gratitude to health and social care workers and scientists around the world who've been working tirelessly to save as many lives as possible. Thank you.
Thank you very much. Romania, you have the floor, to be followed by Israel.
Thank you very much. Mr. President, Director General, Excellencies, Romania fully aligns itself with the UN and its member state statement. We would like to thank the General Director for the comprehensive report presented. Romania highly appreciates the continuous efforts of the World Health Organization as the leader of the international public health architecture and believes that the UN system must be central to our global action. The COVID-19 pandemic has shown once again that global challenges require common action, solidarity, and cooperation. Romania values the essential role of WHO in the fight against COVID-19, supporting member states in the implementation of their health policies, strengthening effective health system, mobilizing the international community for the development of the new diagnostics, therapeutics, vaccine, but also putting in place the instruments for equitable access to them. Our debates take place almost 1 year after the outbreak of this pandemic. The current global situation remains dire, as many healthcare systems are overstretched and need to find adequate answers. There are reasons for hope given by recent evolution in the vaccine development, production and distribution, and by the beginning of the immunization campaigns. Ensuring equitable access to COVID-19 vaccine is essential, and WHO role is crucial to avoid discrimination between countries and people. We have all faced new, complex and difficult situations in the past year due to the pandemic, and also to the need to continue ensuring the necessary health services for our pandemic and for our population. It is of utmost importance to use in a most efficient and pragmatic way the experience we have accumulated and the lesson provided in order to consolidate and to adapt our health system for future pandemics or other public health global emergencies. This has to take place in an articulated manner at national, regional, and international level, with WHO having an active participation to this process. We need to continue our debate on different proposals of strengthening the WHO pandemic preparedness advanced by the member states. We need to use also the conclusion and recommendation of the reports from the Independent Panel for Pandemic Preparedness and Review, the Review Committee of the International Health Regulation, and the Independent Oversight and Advisory Committee of WHO Health Emergency Program for consolidation of our organization. Thank you very much.
Thank you. And now to Israel, to be followed by Germany.
Thank you, Chair. Director General, Member States, Excellencies. 1 year ago, the world as we know it changed forever. Now more than ever in the history of public health, coordination, cooperation, and collaboration have been vital in minimizing the damage to health systems, economies, and of course the individuals affected by this outbreak. First, we must stop and acknowledge all the frontline workers, from EMTs, paramedics, pharmacists, nurses, and doctors, to cleaners, orderlies, caregivers, social workers, drivers, IT and security personnel, and everyone else whose work has been an integral in dealing with this pandemic. During the last year, the State of Israel has been grateful and proud of the work we have done with the WHO in dealing with the COVID-19 pandemic. When countries share data and best practices, we ensure that professional advisory organizations such as the WHO have the tools and the experts need most to help guide our health systems in dealing with the pandemic of this scale. The WHO's publishing of hundreds of COVID-19 related guidance materials have been invaluable to Israel and our partners in managing our pandemic response, and the transparent, evidence-based information has been especially important. Going forward, it is important to ensure that we continue to strengthen the systems set up during this pandemic, including early detection, verification, and warning of novel virus strains, and data sharing and reporting mechanisms. The WHO serves as the nucleus of World Health, and the organization must be able to disseminate accurate information worldwide as soon as data is available to ensure maximum efficiency in dealing with any health crisis in the future. We must also remember, while thanks to the efforts of biologists, chemists, genetics, pharmacologists, and doctors worldwide have given us hope that the pandemic must soon be behind us. Even in Israel, where we have vaccinated over 2 million residents, we must not allow pandemic fatigue to negatively impact our decision-making. We are actively sharing the knowledge we gain from this process with WHO and other countries. The WHO has also been integral in ensuring that not only do we not fall into pandemic fatigue, but that we also don't become too pandemic focused. And we must continue working to ensure that all essential health services are supported even during these tiring times. Lastly, as countries prepare to vaccinating their population, we'll again be fighting against misinformation and uncertainty. The WHO will play an important role in advising all countries on managing potential anti-vax movements with positive messages and transparent data-based information campaigns. The end is in sight, and we must continue our important cooperation to get there. Thank you.
Thank you, Israel. And now to Germany, to be followed by Austria.
Can you hear me? Okay.
Yes, thank you very much.
Wonderful. Okay, sorry. Germany aligns itself with the EU statement held by Austria. An unprecedented year for WHO. Every member state and all of us individually lays behind us. And while there are prospects for the end of the pandemic at some stage this year, COVID will remain a key theme for our lives in 2021 and beyond. DG, you have said it very clearly. COVID is the greatest crisis of our time. The international structures have proven not to be adequately prepared for a global health crisis of this dimension. Never before the international attention has been so focused on WHO like in this crisis. As we have stated before, COVID has shown the world's expectation vis-à-vis WHO by far outweigh WHO's de facto abilities. There is a serious discrepancy in between our political appraisal for WHO and the common will of 194 member states to finance the needed capacities. To enable WHO to fulfill its ambitious mandate should be one of the key tasks for all member states. Within its limited financial, human, and legal capacities, WHO has played and still does play a crucial role in the ongoing response, and we applaud the DG and all staff for your dedicated commitment through your work for WHO. COVID-19 has the potential to reorder the global health architecture far beyond WHO. In this regard, the Global Action Plan for Healthy Lives and Well-being for All, which brings together 12 key multilateral actors, can and should play a crucial role for coordination and alignment. On the 7th of October, the German government has adopted a new strategy on global health. Its key objective is to contribute to the achievement of the health-related Sustainable Development Goals by 2030. With the strategy, Germany clarifies that we want to strengthen WHO coming out of this crisis. A WHO that is fully equipped to fulfill its mandate as the leading and coordinating authority in global health. Given the lessons learned process, the year 2021 will be decisive and a unique opportunity to align WHO's financing, governance, and mandate in order to ensure its leading role in global health. Germany is fully committed to bold reforms. Only a truly enabled and strengthened WHO can serve as the needed safeguard for global health and health security for all in the future. I thank you.
Thank you very much, Germany. And now to Austria, to be followed by China.
Thank you, Honorable Chair, Director General, members of the Executive Board. Austria aligns itself with a statement made by the European Union and member states, and not to be confused, this is our national statement as a member of the Executive Board, not on behalf of the European Union. Austria thanks the Director General for his report and constant personal engagement in this challenging period of the COVID-19 pandemic. Austria reassures you of its continuous engagement in the multilateral system of securing global health. We appreciate all the valuable work on coordination and information provided by WHO and its tireless staff during the pandemic, while we reaffirm the need for a flexible and prompt handling within the governance structure, in particular in crisis times. And you know also my criticism that the Executive Board as a governing body is not playing its role as it should, and I'm looking forward to have our retreat
convened as soon as we can meet again face to face. Dear Dr. Tedros, regarding COVAX facility, I want to direct some questions directly to the management of Gavi COVAX. We are here the executive board, the governing body, so I think we need some answers directly from there, because it's not directly you, Director General, who is doing this crucial work. The basic principles of COVAX are a fantastic idea, no questions. Equal access to vaccines are crucial. But I see substantial shortcomings of COVAX to deliver, and it's on its heroic goals. COVAX is slow, has not closed the crucial numbers of contracts, and therefore substantial numbers of vaccines being timely delivered to the member states. So there are questions to be answered. What did the management of Gavi COVAX do to create a transparent and inclusive work process towards reaching its goals? What do I mean? I'm personally the co-chair of the steering board of the procurement group of the 27 EU member states and the European Commission. Since early June, we have been meeting each and every week at least once, if not 3 times, making strategic decisions, putting together a broad portfolio of vaccines. Our joint negotiation team is practically meeting daily. So transparency and inclusiveness is a key for success on delivering our vaccine plans and the procurement processes behind it. I want to state clearly, we did do our homework within the European Union to secure the needs for our 450 million US citizens to have access to this urgently needing vaccines. We were in the European Union skeptical that Gavi COVAX had the means and the capabilities to fulfill its task to negotiate the necessary contracts and to secure the needs of our citizens. More, the proposals that Gavi negotiated side by side with the European Union, with the producers, was rejected by the management of Gavi COVAX. So I would like to express the clear statement that the European Union and its member states are exercising its global solidarity, and we are the single largest donor when it comes to supporting Gavi COVAX facility. Another crucial question, why and on which grounds did the management of Gavi COVAX decide earlier last year not to include the mRNA vaccines in the portfolio of COVAX? This was a major mistake, taking into account that the mRNAs are the early ones on the market and the golden standards now when it comes to COVID vaccines. What are the detailed delivery plans of Gavi COVAX management? So what numbers of vaccines can member states expect to be delivered? I don't see any clarity on this matter. Dr. Tedros, I personally know about your efforts to secure access to vaccines to all member states around the world. And you are fighting a heroic fight in this question. So I'm not directing my criticisms to the person.
With respect, we would
have to state clearly that Gavi COVAX has to do a better job. The glass of delivering is not even half full. Thank you very much, Chair.
Thank you very much, Austria. And now to China.
Distinguished Mr. Chair, hello to everybody. The Chinese delegation appreciates the hard work and the fruitful work of the Director General and the Secretariat and the past year. 2020 is an extraordinary year, with COVID-19 pandemic spreading around the world, and countries facing greater challenges in achieving SDGs by 2030. The Chinese government has always put people's safety and health first. President Xi Jinping personally commanded and deployed the COVID-19 prevention and control, and this is still, China is still doing so in a constant manner. We are now in winter, and China is facing greater pressure of prevention and control. While doing our own prevention and control, we are, as always, supporting the DG and the Secretariat in implementing the COVID-related resolution of WHA 73. After consultation, the WHO International Expert Group on Virus Origin Investigation arrived in Wuhan on January 14th. They are following the quarantine regulations and epidemic prevention requirements, showing a high degree of professionalism and dedication. They have had several video exchanges with the Chinese working group, and the two sides will further jointly carry out scientific cooperation in investigating the origin of virus. China supports and has joined the COVAX facility. We shall take concrete actions to support that vaccines should be global public products, and vaccine availability and affordability in developed countries should be enhanced. China calls on the international community to make unremitting efforts to prevent and control the pandemic, safeguard people's health and promote economic and social development, and jointly build a community of common health for mankind. Thank you.
Thank you. And now to Bangladesh, to be followed by the Russian Federation.
Yeah. Thank you so much, Mr. Chairman, Excellencies, ladies and gentlemen. I, on behalf of our Honorable Minister, Minister of Health and Family Welfare, Bangladesh, I am the Secretary Health Service Division in the Ministry of Health and Family Welfare in Bangladesh. I would like to share something about the meeting of Executive Board. Mr. Chair, I thank the Director General for providing us with the updates on WHO's work on some key areas of public health, including the COVID-19 vaccines. Nearly a year into pandemic, we face a human tragedy and a public health, humanitarian, and development emergency. We wish to place on record our appreciation to Dr. Tedros and his team for their tireless efforts in fighting this global menace. Also, I would like to mention Mr. DG of WHO. Very recently, you have sent a letter to our Honorable Prime Minister, Sheikh Hasina, appreciating her to face the COVID situation in Bangladesh effectively. And as a resilient country, Bangladesh, in facing a COVID situation rightly and with a very important, having a very important steps. So I'd like to convey my thanks and gratitude to Mr. DG, Dr. Tedros. Thank you very much for your appreciation letter to our Honorable Prime Minister. And after a rough year, there is a light at the after a rough year, there is light at the end of the tunnel. We look forward to having a COVID-19 vaccine for most of us in 2021. We highly commend the strenuous efforts made by scientists around the globe in this regard. We thank WHO, Gavi, CP, and other organizations for their active involvement, support, and participation. It is indeed a remarkable achievement to reach this point in just a short time. Mr. Chair, our Honorable Prime Minister has urged the international community to treat the vaccine for the COVID-19 as a global public good and ensure its timely availability to all countries at the same time. Under her leadership, we adopted a whole of the government approach in Bangladesh to respond to the pandemic for the very beginning. Now we are exploring every possible avenue to bring in vaccines Once it is available, the frontline workers, including the doctors, health workers, and law enforcement members will be vaccinated on a priority basis. In this respect, we particularly thank the COVAX facility for its valuable support. We are also thankful to other friendly countries and our partners from the private sector for their generous contribution and cooperation. Mr. Chair, while we recognize the development of vaccines as a breakthrough, we need new thinking on how to get our economics back on track. Low and middle income countries need greater assistance for strengthening their health system further. The pandemic is a clarion call on investing more in emergency preparedness while reinforcing One Health approach and a stronger WHO. We must pay attention to develop innovative and digital health solutions to better prepare for the future. Indeed, fighting the pandemic is the key to all of us, but we must not shy away from other dominant global health concerns. Today,
apologies for interrupting,
resistance
Bangladesh.
is a serious political,
with
social,
respect,
and
we
economic
would just
problem.
wish to remind you of the time. Thank you very much.
To conclude, this is a high time to build back better for our people, not just for now, but also for generations to come. We can only achieve this if we remain united in solidarity. Thank you. Joy Bangla, Joy Bangabandhu.
Thank you. And Russian Federation, you have the floor.
Distinguished Director General of the WHO, distinguished Chairperson, I would like to begin my statement with thanks to all of the medical workers throughout the world who have been fighting the pandemic, which has been a threat to the entire international community. The events and to work against and prevent COVID-19 have allowed us to have a positive development and prevent. We have worked on a number of innovational technical vaccines to fight COVID-19. The Russian Federation has begun to roll out its vaccine in all regions of the Russian Federation. Since they need special transport, currently we have more than 1 million people that have been vaccinated. We haven't seen any major negative impacts. They are effective vaccines and has allowed us to reliably protect the entire population. Recalling the declaration of the G20, we opened a collaboration effort to ensure access to the vaccine and equitable manufacturing. We would note the key role of the WHO in fighting COVID-19. The organization has been able to operationally and quickly respond to this infection and create a number of different collaboration mechanisms for countries. However, we would underscore the importance of transparency in information and protecting against new diseases. We would recall the high level of economic interdependence of member states. It depends on the development of the vaccine. And we need to make sure the quality and the methods of information and all of the different indicators and the impact of course, the vaccine on the international society. We would like to thank the Euro Bureau of the WHO, and we thank them for the initiative to create a commission. We note the need to strengthen the guidelines. Would you take over, please? We note the duplications in a number of WHO regulations and the coordinating role in fighting the pandemic, as well as the need for an rule regulation regulator. Would you please?
Отмечаем проделанную IPPR работу и выражаем готовность.
We note the work of the IPPR and the Commission. However, the report of the IPPR, which was published this year, requires more work and contains a number of imprecisions. It should be fully aligned with the normal standards of the UN agencies to have a review. We'd also recall that according to the last report of the WHO, over the last 10 years, no infectious disease has led global mortality such as this one. This has demonstrated the need to increase global attention to this issue. We, of course, call for support for global preparedness to pandemics. I thank you very much for your kind attention.
Thank you very much to the Russian Federation. We shall now move to statements by those member states not represented on the board. And we would also wish to once again remind those making statements to kindly adhere to the timelines. With that being said, I would wish to recognize the distinguished delegate from the Republic of Moldova to be followed by Norway. Thank you.
Thank you. Mr. Chairman, distinguished Director General, dear colleagues, Republic of Moldova aligned itself with the EU statement, and we welcome Director General's report and take this opportunity to reaffirm our commitment to continue supporting its activity, notably delivering positive results in the fight against COVID-19 and beyond. Likewise, we would like to express appreciations to every stakeholder, wherever individual or collective, who committed to and contributed to discovering effective vaccines, who worked tirelessly to develop efficient tools in fighting the pandemic and provided equitable access to vaccines and other commodities. COVID-19 pandemic has once again highlighted the need for a multi-sectoral approach to strengthen national and global public health security. It has also emphasized the prominence of strong health systems and emergency preparedness, proving the urgency of universal health coverage. At the same time, we share Director General concern on the way the immunization has developed so far, where there is definitely a large room for improvement when it comes to solidarity and equity. In addition, the current crisis clearly indicates the need to further strengthen national capacities for the implementations of the provisions of the international health regulations, based on national context and national assessment of risks and needs, efficient funding and lessons learned from the current pandemic. Republic of Moldova was among the first countries to approve a cross-ministerial plan for the implementation of the regulations, with an effective distribution of responsibility between ministries and departments involved. We would like to echo again Director General's appeal to enhance One Health approaches at all levels, which is essential in combating global health threats. Updating electronic surveillance systems for infectious disease and public health events, as well as introducing IT solutions for data collection and exchange, is crucial in this context. The COVID-19 pandemic demonstrated the importance of developing and delivering resilient and integrated health services to meet the full range of health services needs and provide access to affordable, efficient, effective, and high-quality healthcare for everyone, particularly vulnerable people. At the same time, we recognize that while governments indisputably undertake a leading role in framing health systems and providing healthcare services, not one stakeholder can fully deliver in the pursuit of universal health coverage. The design, delivery, implementation, and last but not least, financing requires all stakeholders, public, private, and non-profit, to participate in order to consider the full complexity of health systems and provide efficient solutions for different models. Thank you.
Thank you. And now to Norway, to be followed by Sweden.
Director General, ladies and gentlemen. Norway thanks the World Health Organization's continued leadership in dealing that the World Health Organization-led mission gained access to China to pursue the origins of the COVID-19 virus finally started. This is an important development. During pandemics and health emergencies, we look to the World Health Organization for leadership. As member states, we must ensure that the World Health Organization at any time has the tools, the resources, and the authority it needs to fulfill its mandate. Norway is very concerned about ensuring early access globally and hope this can be addressed soon. All member states must step up. Norway has made considerable contributions in order that there is early access to vaccines, diagnostics, and therapeutics. We would encourage others to support the 4 pillars of the Access to COVID-19 Tools Accelerator. Increased support is needed in order to fight the pandemic. We need a thorough discussion and decision on the financing. A broad perspective on sustainable financing through several channels is required. We share the view that the severe imbalance between assessed contributions and voluntary contributions is harmful for the World Health Organization's independence. Norway is supportive of proposal to strengthen sustainable financing for the World Health Organization, including through increased assessed contribution. In the same manner as COVID-19 has tested countries' preparedness and response, COVID-19 has tested the World Health Organization transformation and its ability to deliver results in countries. We are particularly impressed by the way the World Health Emergencies Program has stepped up to the world in a very difficult time for all of us. The importance of improved science and research into non-pharmaceutical interventions to generate evidence has become obvious to all. We believe that the World Health Organization can play a leadership role in strengthening research in this field. We are looking forward to contribute finding ways forward to strengthen the World Health Organization. Thank you.
Thank you. And now to Sweden, to be followed by Japan.
Thank you, Chair. Sweden aligns itself with a statement made on behalf of the EU and its member states, and we thank the GD for the report. This past year has been extraordinary for both the WHO Secretariat and for member states. Our health systems, our crisis preparedness systems, and our societies at large are being pushed to the limit. Our efforts to safeguard universal health coverage, increase protection from health emergencies, and promoting healthier lives are challenged. The work of WHO is important for all of us. And this past year has shown the world the importance of health for all. That's why we need a strong WHO that is fit for purpose, adapted to the needs in countries and underpinned by sustainable finances and strong governance systems. The COVID-19 pandemic has, like never before, illustrated the need for global leadership in health, and Sweden reiterates its strong commitment to the role and leadership of WHO, and we thank you, Dr. Tedros, for your leadership during this difficult period, and we thank the WHO staff for their extremely hard work. The challenges ahead are vast: to curb the spread of infection, ensure equal, equitable, and swift distribution of safe, affordable, and effective vaccines, minimize indirect impacts, to rebuild health systems and reinforce crisis preparedness. We are facing a backlog of unmet health needs as a result of the pandemic, including NCDs, mental health conditions, and SRHR services. This needs must urgently be addressed. It's important to learn from crisis, as well as to manage it. That is why the Swedish government has appointed a Corona Commission to present lessons learned and highlight where improvements can be made. This is also done in several of the expert agencies in Sweden involved in the pandemic response. Sweden would welcome a similar approach from the Secretariat and would be interested to learn how internal work processes in the WHO Secretariat have been affected and if there are lessons to be learned from that. Finally, Sweden reaffirms its support for the work of the independent panel, the IHR Review Committee and IOAC, and look forward to discussions on how to take the recommendations forward to create more resilient health systems, promote healthier lives, and improve global preparedness for new health emergencies. I thank you all.
Thank you, Sweden. And now to Japan, to be followed by Jamaica.
All of the hard work and the dedication by General Dr. Tedros and the WHO Secretariat at this difficult time of COVID-19. Taking this opportunity, I would like to make a few comments. First, we believe that the strong and resilient health system is essentially needed, underlying the importance of universal health coverage. To achieve this, we need pharmaceuticals, medical devices, human resources, and sustainable health financing. The COVID-19 pandemic reminded us of the renewed importance of resilient, efficient, and agile health system. In addition, vaccine is a key tool to contain this crisis. Japan decided to join the COVAX facility at the earliest date, which is expected to speed up and scale up global vaccine production and allocation in an equitable manner. Second, as for WHO reform, we think an impartial, independent, and comprehensive evaluation is necessary to review WHO's responses and the country's initial response to the spread of infection. Third, Japan has been focusing on international cooperation in global health, jointly tackling COVID-19 and other emerging infectious diseases. Furthermore, we have been supporting global health agenda, including polio eradication, antimicrobial resistance, and non-communicable diseases, which we are happy to discuss during this executive board. To conclude, I would like to reaffirm our strong commitment to tackle health priorities at the global level and share our willingness to work together with WHO and member states. I thank you.
Thank you, Japan. And now to Jamaica, to be followed by Turkey.
Chair, Jamaica wishes to thank the Director General for his report. We commend the DG and his team for, in particular, efforts related to the equitable distribution of vaccines as a global public good. Jamaica has been positioning itself for the rollout of vaccines on COVID-19. We have established a national COVID-19 commission, which will provide guidance and oversight of our national COVID-19 deployment and vaccination plan. Our efforts have been bolstered by the country's history of managing vaccination and immunization programs, as well as our robust legal and regulatory frameworks relating to health and food and drugs. Jamaica, as a participant in the COVAX facility, wishes to reiterate the importance of multilateralism through procurement and equitable distribution of vaccines and diagnostics to combat the pandemic. We're also hopeful that countries will fulfill their commitments and fully support this multilateral initiative. Jamaica and other countries depend greatly on the success of the facility. Chair, we'd like to take this opportunity to commend the DG for his strong leadership and trust to maintain the business continuity of the WHO during the COVID-19 pandemic, including on organizations' non-COVID-19 work, pursuant to the 13th General Program of Work. The design of the program budget for 2022 to 2023 in a flexible and sustainable manner to ensure that the WHO is fit for purpose and can effectively support member states. We look forward to the organization's continued support to our national efforts at achieving universal health care and coverage and the sustainable development goals. Thank you, Chair.
Thank you, Jamaica. We appreciate the virtual background. It felt as though you're in the room with us. And now to Turkey, to be followed by France.
Thank you, Chair. We would like to thank Director General for the report. There's an increasing concern in international community that countries with limited sources will have late access to COVID-19 vaccines. We commend the Director General's efforts in pointing out this risk as a threat to global public health, and we support the DG, WHO, and all relevant partners to take necessary steps to avoid inequitable distribution of COVID-19 vaccines. Chair, there is not a single answer to the question of how emergency and outbreak preparedness in the new period should be. Since we are still in the process of assessment and in the acute phase of pandemic, pointing a concrete answer would not be completely realistic. However, the pandemic has presented us an important opportunity to reshape our national, regional, and global policies in light of the lessons learned. We have no doubt that the DG would guide WHO and member states with necessary steps by taking into consideration the reports from IPPR, IHR Review Committee, and IOAC. Chair, we support 5% increase in the proposed program budget as a reflection of budgetary increase in base program segment in all major offices. However, we'd like to learn more about the financing of the emergency operations and appeals, including the projections and change in the donor base. The contributions of donors for the emergencies are used mostly on operations at the country level to enhance the country impact. We would also like to stress upon the importance of transparency regarding expenditures of these funds by country offices. Transparency at the country level is crucial for transparency at organization-wide. We have no doubt that the necessary oversight mechanism will be at use at the country level and that member states will be informed regularly regarding the changing situation of donor base. Thank you.
Thank you. And now to France, to be followed by South Africa.
Thank you, Chairman. Chairman, Director General, France would like to associate herself with the statement made on behalf of the European Union. The current health crisis has reminded us more strongly than ever that health is a common good, which requires our determined and continuous commitment. Because global health depends on our ability to meet health challenges together, we need a strong and recognized WHO. In responding to COVID-19, we have together launched the ACT-A initiative with its goal of developing, producing, and making available diagnostics, therapeutics, and vaccines to tackle COVID-19 in an equitable and universal way, and, of course, to provide support to health systems. Thanks to our efforts, vaccination campaigns through the COVAX and ACT-A facilities are going to start. However, we know that vaccines alone are not enough. We must also mobilize to provide therapeutics, diagnostics, and strengthen health systems. COVID-19 has highlighted the need to have reliable information based on science and information that highlights the link between human, animal, and environmental health. We have therefore set up the One Health High-Level Expert Council. I'd like to thank WHO, the FAO, the OIE, and UNEP for their commitment to and cooperation with this important project, which should be got up and running before the WHO in May this year. The current pandemic has confirmed the crucial role played by those in health systems worldwide. They have been devoting themselves with tireless energy to helping to overcome this health crisis since it started, and we should support them in everything they do. In helping to train them, we have set up in Lyon a global health academy, which has already contributed through its classes to enhancing the response to the crisis. It's also been promoting gender equality. With a view to the forthcoming Generation Equality Forum in June this year, France would like, alongside WHO and Women in Global Health, to get countries to commit themselves more strongly to better including women in those structures which make major decisions about health, and to guarantee health professionals, the most of whom are women, safe and decent working conditions. 2020 was a year when we asked ourselves many questions. We hope 2021 will be that when we can answer them and bring an end to the pandemic. Thank you.
Thank you, France. And now to South Africa.
Thank you. Thank you, Chair. South Africa would like to align with the statement presented by Burkina Faso on behalf of the African member states. In our presentation, we would like to underscore 3 brief points. Firstly, we would like to take this opportunity to appreciate the Director General and WHO staff for their efforts in addressing the COVID-19 pandemic, in particular the attention to making a fair, equitable, and attention to fair, equitable, and timely access to vaccines and other COVID-19 tools. And this, of course, particularly for less resourced countries and communities. We strongly support the passionate call made by the Director General in this regard this morning. The general program of work and the decisions to be taken by this executive board are of immense importance. Achieving sustainable financing for the organization cannot be delayed any further. We give strong support to recommendations to strengthen WHO at all 3 levels, in particular at country level and the regions, in order for WHO to fulfill its mandate. Our third point is on support to countries. This is necessary to maximize provision of health services and sustainable health systems, which are necessary to prevent further loss to health gains that have been made over the last decade. Our focus on improving health outcomes through universal health coverage cannot be overemphasized. We also recognize that health systems are the delivery mechanisms for all the COVID-19 tools. And so we believe that we really need to be giving support to countries to be able to fulfill these mandates. I thank you, Chair.
Thank you, South Africa, and thank you to all of those member states who made live interventions. I understand we also have 2 pre-recorded statements, those being from Poland and Spain. If we may now play those. Thank you very much.
Thank you, Chairman. Chairman, Director General, distinguished ladies and gentlemen, Spain subscribes to the statement delivered on behalf of the European Union and would like to thank the Director General for his statement and his report on WHO's work in the last 12 months. We support the gratitude expressed to the WHO for its work in tackling the global COVID-19 pandemic. We would like to underscore that the global health system needs to be strengthened. It's important we don't forget that, and at the heart of it must be a reformed and stronger WHO. This is recognized inter alia in the declaration called Together for Stronger Multilateralism, set up by Spain and Sweden last year. Our country is committed to WHO. Over the length of 2020, we stepped up our voluntary contributions to the organization and to PAHO by a factor of 7. This should be added to efforts we have made to contribute to EU funds and the ACT Accelerator, of which we are a founding member and a member of its Facilitation Council. We will cooperate with global vaccination programs, supporting instruments such as COVAX and the AMC in order to ensure universal access to diagnostics, therapeutics, and vaccines against COVID-19. There is no doubt that the international fight against SARS-CoV-2 has proven that the international health regulations need to be reformed. It's also confirmed the importance of promoting globally an integrated health system model based on universal health coverage and continuity of assistance at all levels of care. We think this is the best possible moment to demonstrate our intention of not leaving anyone behind. In Spain, we believe that we can emerge stronger from this pandemic. We will do that if we ensure that health is provided to everyone worldwide in an equitable and fair way and covers human, animal, and environmental health from the One Health perspective. Thank you.
Regional directors, colleagues, Poland aligns with the statement of the EU and its member states. To start with, I would like to thank the WHO for its ongoing efforts to fight the pandemic and its leading role in the global COVID-19 response. We are also impressed by the effects of joint global efforts to find an effective vaccine against COVID-19. Never before in the history has a vaccine been developed so quickly. This is a proof that only acting together we could overcome the crisis. Countries on all continents have been hit hard by the pandemic. No dimension of the function of the state has remained untouched. It is no different in the case of Poland. However, current situation can be described as stable. Thanks to the joint effort of the whole society, with great dedication of medical staff, the basic safety of citizens is ensured. Nevertheless, threats remain real, thus national services are still on the highest alert. We are convinced that the only way to end the pandemic is mass and rapid vaccination. We call on the international community to ensure that vaccines are available for everyone. By the end of December, Poland has started its COVID-19 vaccination program. Despite many challenges, we can say that the whole process is well organized and goes smoothly. In addition to the logistical challenges, including the availability of adequate number of vaccines in a short time, we also recognize refusal to vaccinate as a potential threat in overcoming the pandemic. While there have been positive trends recently, the problem remains significant. But we know that this problem is faced not only by Poland. We would gladly welcome joint approach to this issue. Honorable Director General, colleagues, a year ago, no one expected that a new virus will so strongly affect our lives. A year ago, no one expected that the world will respond to this challenge so successfully. We cannot celebrate yet. The fight is not over. We must keep acting together in a spirit of solidarity and trust, as it is the only key to an ultimate victory. I thank you.
Thank you very much. And now back to His Excellency, Mr. Chair.
I would now like to give the floor back to Director General Dr. Tedros to respond. Dr. Tedros, you can have the floor, please.
Yeah, thank you. Thank you so much, Your Excellency. I think the inputs from member states are very important, and most of them are with recommendations and feedback. And we have taken note of the feedback, the inputs and recommendations. So we will move accordingly. Thank you also for your, many of you for appreciating our staff. As you rightly said, they have been working very hard the whole year, and of course under a very stressful situation. And thank you for that recognition. And I assure you that we will continue to work harder and we will not rest until this pandemic is over. But having said that, if my colleagues, there are some specific issues would like to comment, I would be happy. Yeah? Okay. So thank you very much again, Chair. Thank you.
Thank you, Dr. Tedros. I see no further comments on this item. Let me thank the Director General and the Board for this fruitful discussion. This concludes the Board's consideration of Agenda Item 2. We shall now consider Item 3, report of the regional committees to the Executive Board contained in document EB 148/4. The floor is now open for discussion. I would like to once again request that the Secretariat moderate the discussion on the virtual platform. Secretariat, you have the floor, please.
Thank you, Your Excellency, Mr. Chair. May we kindly remind those wishing to make an intervention to please raise their hand once again in the Zoom platform. I wish to recognize Austria would wish to take the floor. Thank you. Austria, the floor is yours.
Thank you very much, Mr. Chairman. I speak on behalf of the EU and its member states. The candidate countries, the Republic of North Macedonia, Montenegro, and Albania, as well as the Republic of Moldova, aligned themselves with this statement. WHA Resolution 73.1 constituted the first joint response by the WHO's membership to COVID-19. It showed that multilateralism, international cooperation, and solidarity work and are the most adequate answer facing a pandemic. We welcome the progress made by the Secretariat and Member States in the implementation of the resolution. Proactive follow-up remains key to guide our responses, WHO Secretariat and Member States alike. For the global response, equitable access, rapid development, and fair development of COVID-19 vaccines, therapeutics and diagnostics, as well as the strengthening of health systems for their deployment, are essential. In partnership with WHO, the EU has been playing a central role in setting up, funding, and co-hosting ACTA as the central mechanism to achieve these goals. We support the full realization of ACTA, including its vaccines pillar, COVAX, which we support both via the AMC and as a self-financing participant, so that all who need COVID-19 vaccines have access to them. To ensure ACT's success, we encourage support of all member states and stakeholders. We also need to address the funding gap, as well as the gap in vaccination between countries. Vaccine donations are also to play a key role. The EU will continue to be a reliable partner and champion for resilient health systems and universal health coverage. The One Health approach at all levels and the objectives of the Global Action Plan for Healthy Lives and Well-being for All to reach the SDGs and to strengthen cooperation among health actors. Mr. Chairman, WHO is an evidence and science-based organization for global health. In this spirit, the resolution asks for an investigation of the source of the virus. Understanding the origin will enable us to better control and respond to this pandemic and future health threats. We welcome that the international expert team was finally allowed to travel to China to start their investigation in cooperation with Chinese counterparts. We attach great importance to this investigation, which requires transparency, access to locations and data, and full cooperation, and we request to be regularly briefed on the progress. Given the danger posed by emerging mutations of the virus, we understand the importance of sharing of genetic sequence data. We thank the UK, South Africa, and other countries for sharing insights and data quickly, and welcome WHO's increased efforts to expand scientific cooperation. 2020 was a year of doom. We all hope that 2021 will be a year of hope. However, the pandemic is far from over. We all must continue working hard nationally, regionally, and globally through multilateral cooperation, trust, and solidarity. With the help of the evaluation processes currently underway, we also need to learn from our mistakes and make bold moves to better prepare for and respond to future pandemics, even whilst combating and recovering from the current one. Thank you very much, Mr. President.
Ambassador, thank you for that intervention. I believe you were actually intervening under item 14.1. The topic we are now discussing is item 3 report of the regional committees of the Executive Board. So if in fact you were intending to make an intervention on item 14.1, I would ask that potentially you would revisit that intervention when we open item 14.1. With that, thank you. I'd like to hand the floor back to the moderator for interventions on the report of the regional committees to the Executive Board, item 3.
Thank you, Dr. Armstrong. I would wish to recognize the United States of America. USA, you have the floor.
The United States notes the committees and wishes to highlight the contributions of the Pan American Health Organization, PAHO, and the Western Pacific Regional Office, where the United States participates as a member state. We were very pleased to sponsor the PAHO governance reform that is mentioned in the report and commend our fellow PAHO members in adopting this reform measure unanimously. We would also like to thank Canada, Brazil, and Mexico for their leadership during the Executive Committee and the Directing Council. The United States appreciates the leadership of Dr. Etienne and Deputy Director Valdez and our close and collegial relationship. Their leadership in the midst of the pandemic has been exemplary. Going forward, the Americas, so hard hit by the pandemic, must work shoulder to shoulder to improve global health in our hemisphere and at the same time rebuild our economies. We are confident that the countries of the Americas will come back stronger than ever and hopefully more united. We look to PAHO to take its rightful leadership role on public health issues in the Americas. And in the Western Pacific, we hope to learn from our friends and partners how they were able to largely contain SARS-CoV-2. Thank you very much.
Thank you very much to the United States of America. We might just give it a very brief moment to see whether there might be any further member states who would wish to make a statement under agenda item 3. I understand that Portugal would wish to take the floor. Thank you. And Portugal, you have the floor. Portugal, it seems that we're unable to hear you at this time. We would just ask that you double check the sound. We will do the same. Thank you.
Like this? Hello, can you hear me?
I can confirm we can. Thank you very much, Portugal.
Thank you very much. Apologies. So, Mr. Chair, Director General, Excellencies, Portugal endorses the report of the regional committees and praises the important role that WHO plays through their regional offices, particularly in implementing, supporting, and advancing health policies and country-level priorities. We commend the new and timely program of work of WHO Euro, stressing its 3 core priorities, which we also take as our own. We highlight the importance of moving towards universal health coverage, while this translates directly into our national service, cornerstone of social inclusion, and the guarantee of universal health care in which access and equity are safeguarded. Mr. Chair, the COVID-19 pandemic has dominated the global public health agenda as few health issues have done before. We highlight the progressive efforts of WHO in preparedness of countries, strengthening their capacities and ensuring coordinated and effective support when faced with cross-border health threats. We expect these threats to be more and more frequent. We emphasize the future role played by the EU in strengthening regional preparedness, synergistically with WHO, as well as the relevance of the International Treaty on Pandemics proposed by the European Council. These actions will be crucial in order to face future health emergencies anchored in international mobilization and solidarity, allowing us to better anticipate, prepare for, and respond to future pandemics. A stronger and better prepared EU means also a stronger world, and we are all in the same battle against the same common enemy. Thank you.
Thank you very much, Portugal. And now to Guinea-Bissau. Sorry, Guinea-Bissau, I'm just wishing to confirm that you would still wish to take the floor under agenda item 3. It seems not to be the case. As we have no further hands up from member states, we would suggest through His Excellency, through Mr. Chair, that we would give the floor to the WHO regional directors. I understand that the regional director for Southeast Asia, Dr. Poonam Singh, would wish to take the floor. The floor is yours. Thank you very much.
Chair, Excellencies, Director General, the 73rd session of the WHO Regional Committee for Southeast Asia was held on 9-10 September last year, with Thailand as the host. It was chaired by His Excellency, Mr. Anatun Chanvirakul, Deputy Prime Minister and Minister of Public Health, Royal Thai Government. There was a ministerial roundtable which was held on COVID-19, and it comprised of 2 sub-items: country experiences and lessons learned with future transition to the new normal, and the second on maintaining essential health services and public health programs in the context of COVID-19. The committee adopted a resolution endorsing a ministerial declaration on collective response to COVID-19. The declaration highlights member states' commitment to maintain essential health services while building on the region's many strengths in responding to the pandemic. It calls for securing the occupational safety of health workers, strengthening health information systems, and the uptake of digital health technologies, and advancing health policy and systems research on COVID-19. The midterm review of the Decade for Health Workforce Strengthening in the Southeast Asia region was discussed, which highlights the region's progress on human resources for health, and a report on improving retention of health workers in rural and remote areas. Case studies from 6 countries of WHO Southeast Asia region highlighting good practices on successful rural retention policies were presented. An annual report on monitoring progress on UHC and health-related SDGs, and a publication on monitoring progress on universal health coverage and the health-related sustainable development goals in the Southeast Asia region was launched. The committee reiterated the importance of achieving UHC and of making tangible progress towards achieving SDG 3 and the GPW 13 triple billion targets, even in the ongoing COVID-19 response and recovery. On the WHO transformation, the committee noted the draft report on transforming for enhanced country impact, as well as the report from the Director General titled WHO Transformation and Overview. In the discussions that followed, the region's progress on the transformation agenda, particularly in relation to the region's flagship programs, was discussed. As part of WHO's transformation agenda, an accelerating implementation of Pillar 2 of GPW 13 on an innovative mechanism like CRF was appreciated by the member states. This financing mechanism for preparedness and response and its linkages with health system strengthening will go a long way in building community resilience. It is noteworthy, by the end of 2018-19 biennium, 80% of all resources in the region were being allocated to the country level, an increase from 70% from 2014-15. All countries of the region have carried out a country program and administrative review, and more than half have aligned their country cooperation strategies with GPW 13. The region has achieved zero overdue DI reports, and just 1% of all donor reports have been overdue. Region and country office programs are now aligned with the GPW, as are the regional office budget centers. Notably, the Regional Committee adopted a decision on the Global Patient Safety Action Plan, requesting that regional actions be prioritized in keeping with the Global Action Plan, the regional strategy, and country context. Discussing the program budget 2020-21 implementation, the committee observed the need to regain momentum to implement the planned activities in 2021 work plans while continuing with the COVID-19 response. I would like to mention here that though the development of program budget 22-23 was not discussed in RC 73, a regional consultation on the proposed program budget was held on 9th December 2020 as part of the inclusive, consultative, and joint bottom-up planning process traditionally followed in the region. I hereby thank all member states in the region for contributing to a very productive, active, and engaging 73rd session of the WHO Regional Committee. My thanks to the Director General, Dr. Tedros, for sharing his thoughts on several strategic issues. Before concluding, I take this opportunity to thank member states for their keen participation in a series of key meetings that were convened by the regional office in recent weeks on the deployment and vaccine preparedness. Immunization stakeholders from across the region can rely on WHO's steadfast support as together we strive to equitably and efficiently deploy COVID-19 vaccines to promote health, keep people safe, and serve the vulnerable in these very challenging times. I thank you, Chair.
Thank you very much, Dr. Singh, Regional Director for the Southeast Asia Regional Office. Just before we do move to the next regional director, whom would be regional director from Europe, we understand that one of our EB members, Guinea-Bissau, would wish to take the floor. If we may suggest that they would do so now. Thank you very much. And Guinea-Bissau, you have the floor.
Good afternoon. Guinea-Bissau is making this statement, and it's a great honor for us to do so.
Guinea-Bissau, just wishing to confirm that you can still hear us. It seems we're having a connection issue again.
Okay.
As I was saying, Chair, it's an honor for us to make this declaration. We're speaking on behalf of the 47 member states of the African region of WHO. Member states of our region very much commend the work that has been done by regional committees, and we would like in particular to express our deep thanks to the chairs of the regional committees for all that they have done. We have taken due account of the difficult and different circumstances in which regional committees were held last year. We know that there was a very particular set of circumstances, and we would like to thank all of those who worked together to ensure the smooth running of governance mechanisms at all levels of WHO. Consultations were undertaken with a view to developing
the WHO's forthcoming program and budget. And here again, we have to think about the context in which we have had to work. We would very much encourage the Secretariat to continue to consult broadly with Member States on the programme and budget in order to achieve consensus on this as quickly as possible. And we do think that is particularly important as we move towards the forthcoming WHA. We know that a lot of work has been done in seeking to develop global programs of action. And that again is something else that we very much support and we wish to applaud. At WHO as global at the WHA, we know that some very important resolutions will have to be adopted. And I would like to highlight that for Africa, we really saw some historic developments in our region. We really are able now to look to the future with much greater serenity, thanks to what we have achieved at regional level. And we think that our input to the forthcoming WHO can only benefit from that. We do, however, wish to emphasize the need to work in particular on certain further vaccines and other kinds of medication that can allow us to ensure that polio eradication is something that we can continue to be proud of in our region in future. And we know that we are in a much better state than was the case recently, but we still need to consolidate what we have achieved. I would also like to highlight the fact that we were able to have in Africa the first kind of regional health summit that we have ever seen that gave rise to a strategy that gives us a clear pathway forward in seeking to strengthen our healthcare services and ensure that they are better tailored to meet the needs of the African region. We think that at our regional committee level, we were able to adopt a number of very important documents, especially on country presence, that will allow us to guarantee universal health coverage throughout Africa. This is something else that we can be very proud of. We think we have again taken a significant step forward, and we now look to country offices throughout Africa to ensure that we can create the synergies we need and use the comparative advantage that we have in order to guarantee UHC for our continent. We were able, at the Regional Committee, also to adopt a report on healthcare systems. And this report lists the various levels of capacity that we have in order to ensure that we can have a high-performance healthcare system throughout our continent, taking into account the needs and the particular features of every country within the region. We need to ensure that we can all move forward together to achieve this common goal. Now, we recognize that that is an important starting point to allow us to achieve the SDGs, particularly those that are related to health in the near future. Thank you.
Thank you very much, Guinea-Bissau, and pleased that we were able to connect with you. Once again, apologies for the technical issues. May we suggest now that we would return to the Secretariat's responses to Agenda Item 3, those being from our regional directors. We understand that the Regional Director for Europe, Dr. Hans Klug, would wish to take the floor. Thank you, and the floor is yours.
Thank you very much, Chairperson, distinguished board member and delegates. It's my great pleasure to briefly inform you about the work of the 17th Region Committee convened 13 to 15 September last year, virtually, with the adoption of special rules and procedures under the auspices of its chairperson, Dr. Alexei Vladimirovich Tsoi, the Minister for Health of Kazakhstan. Encouraged by calls from member states, we introduced a paradigm shift in the format, the culture and the substance of the regional committee, reducing the format to 2.5 days and organizing the sessions according to 3 dimensions. The first day focused on the political dimension, the second on the technical, and the third on governance, transformation, and financing. I would like to thank our then SERC chair, Dr. Søren Brøstrøm from Denmark, and all SERC members for supporting this innovation. I'm also very grateful to all the 5 regional directors who were sharing with me how they successfully implemented such a paradigm shift to attract maximum ministerial presence. We successfully ushered in a new culture of free, frank, and friendly exchange and discussion with the member states, providing a platform on which to tailor the Regional Committee further as we look towards our 71st session this September. The Regional Director's report was delivered in a TED Talk format, where I laid out the foundations for the future beyond COVID-19 and reflected on the COVID-19 response by the Regional Office through 3 main axes we set ourselves. The first one, keep direct contact with every single country of the 53 member states for a more targeted response. Second, strengthen partnerships with other organizations working in the region. And third, to restructure the regional office to be fit for purpose. We had keynote addresses from our patron, Her Royal Highness the Crown Princess of Denmark, as well as from Her Highness Queen Mathilde of the Belgians, the EU Commissioner for Health, Dr. Stella Kyriakides, and Professor Mario Monti, who highlighted some very important issues on our agenda, such as the inauguration of the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics, the role of the health workforce during the pandemic, the importance of mental health and our plans to launch a mental health coalition, the need for closer coordination and partnership among international organizations, and the longer-term implications of COVID-19 for health and social care systems in Europe. We had an overwhelming support from the member states for the approval of the European Programme of Work 2020-2025, United Action for Better Health in Europe, a year ahead of what was originally planned. The EPW aligns the regional actions and priorities with the global strategic priorities of GPW 13, also placing people squarely at the center by drawing on the legitimate expectations of citizens vis-à-vis their health authorities. Member states also endorsed the 4 new flagship initiatives on mental health, digital health, immunization 2030, and behavioral and cultural insights, and appreciated that the EPW reflects the impact and early lessons learned from the pandemic, not losing sight of the continuity of essential health challenges and services, fully subscribing to the WHO transformation process. Finally, let me reiterate my great appreciation to the chairperson, Dr. Alexei Tsoi from Kazakhstan, who in heart and mind was close to us, but in distance far away, and virtually did a fantastic job, as well as the other officers of the Regional Committee who helped and supported us tremendously to making the 70th session of the Regional Committee for Europe a truly historical one. Thank you for your attention.
Thank you very much. And now to the Regional Director for the Americas. Dr. Etienne, confirming that you have the floor. Thank you. It would seem that we are unable to connect you at this time. If I may suggest that we would move to the Emro region. We understand that Dr. Jafar Hussein would be taking the floor. Thank you very much. And Dr. Hussein, the floor is yours.
Thank you so much. Thank you. I was muted actually by the Secretariat. Mr. Chair, Director General, Your Excellencies, I have the privilege and honor to present the brief report on the 67th session of the Regional Committee on behalf of the Regional Director, Dr. Al-Mandari. The session was chaired by Her Excellency, the Minister of Health of Egypt, Dr. Hala Zayed. She was physically present in Emro, but the session was otherwise a virtual session. All other 21 member states were connected virtually. The regional committee was for 2 days, 12th to 13th of October, as decided by the program subcommittee before the actual happening of the regional committee. In the inaugural session, after the session was inaugurated by Her Excellency, the Minister of Health of Egypt, a keynote speech was presented by Her Royal Highness, Princess Muna, on the health workers, midwives, and nursing and their role in the COVID-19 pandemic. The session took into account various important global and regional health agenda items. The committee considered several reports relating to the impact of COVID-19 pandemic in the region. It was noted that despite a proactive response in the region, the pandemic was having an alarming impact, including serious disruption to essential health services. The member states called for further action to tackle the pandemic and maintain essential health services, and endorsed a new regional strategic framework on emerging and epidemic-prone infectious diseases. It was noted that the pandemic had also highlighted concern about access to medicine and vaccines in the region, particularly in countries in complex emergencies in Eastern Mediterranean region. And in response, the committee endorsed a landmark new regional strategy to improve such access. The committee agreed to establish a new regional subcommittee on polio eradication, noting that EMR is the only region where polio is still endemic, to ensure high-level oversight of this vital work. Several member states during the regional committee expressed strong interest in joining the subcommittee on polio eradication and outbreaks. In several other resolutions, the committee approved a new procedure for accrediting regional non-state actors not in official relation with WHO to attend its meetings, and endorsed a strategic action framework to improve access to assistive technology. Several items of business, including the proposed approach to develop the new program budget, the draft Global Patient Safety Action Plan, and the global and regional report on transformation were presented as documents, but were not discussed during the paucity of time. Finally, on behalf of the regional director, I would like to extend gratitude to all the honorable ministers of the 22 member states to have shown solidarity and collegiality during this very painful time of the pandemic, where many member states came forward to support those member states who required the much needed support. I thank you, Mr. Chair, Director General, and honorable colleagues, and over to you, Secretary. Thank you.
Thank you very much, Dr. Hussein of EMRO, and to the regional directors of CIARO and Euro for their statements. We understand that the regional director of the Americas would wish to come in. If we may try once more to connect with you. Thank you very much. And Dr. Etienne, you have the floor. It seems we're still having some connection issues there. With that being said, I would hand back to His Excellency, to Mr. Chair. Thank you very much.
Thank you, Secretariat. As I see no more comments now, I take it that the board wishes to take note of the report. I see no objection. The report is noted. This concludes the board's consideration of item 3. Excellencies and distinguished delegates, it is now 1:10 p.m. Central European Time and time for taking the scheduled 1-hour break. We will reconvene at 2:10 p.m. Central European Time and resume our discussions. Thank you.
ये कर दीजिए ये video. Okay.